When it comes to the topic of circumcision, there's no one-size-fits-all answer. It's a personal decision that many parents face, and it can be tough to know what's right for your child. In today's video, we'll help break down the key points you should consider when deciding whether or not to circumcise your baby. Let's dive in. What is circumcision? Circumcision is the surgical removal of the foreskin from the penis. It's typically done when a baby is a few days old, though some parents may choose to do it later in life. The procedure itself usually takes about 10 to 20 minutes, and it's often done in a sterile setting like a hospital or clinic. Circumcision is a common practice in many parts of the world, but it's also a topic with diverse opinions. So what are the potential benefits and risks? Health benefits of circumcision. There are several health benefits associated with circumcision, though they can vary from person to person. Some of the most commonly cited benefits include lower risks of urinary tract infection, UTIs. Babies who are circumcised have a slightly lower risk of developing UTIs, which are more common in infant boys. Reduced risk to penile infections and certain diseases. Circumcision can lower the risk of conditions like balanitis or inflammation of the head of the penis, and reduce the chance of developing sexually transmitted infections later in life. Easier hygiene. Without the foreskin, keeping the area clean can be simpler, especially when a child is younger and might not be able to clean themselves effectively. Decreased risk of penile cancer. While penile cancer is rare, circumcision can lower the risk of this type of cancer as well. It's important to note, though, that many of these health benefits are small and not always definitive. So, while circumcision can provide some health advantages, it's not guaranteed to prevent all health issues. Risks of circumcision. Like any medical procedure, circumcision carries some risks. Here are the most commonly discussed ones. Infection or bleeding. Any surgical procedure carries the risk of infection or excessive bleeding. This can usually be managed if the procedure is done by a trained professional, but it's something to consider. Pain or discomfort. While babies are given local anesthesia, some discomfort can still occur during the recovery process. Changes in appearance or function. In rare cases, circumcision can result in complications like a misaligned or poorly performed procedure, which might affect the appearance of the penis or lead to functional issues later on. It's important to talk to your pediatrician to ensure the procedure is performed safely if you do choose to go forward with it. Let's talk about other factors that may influence your decision. Cultural, religious, and personal considerations. Circumcision isn't just a medical decision. It can also be influenced by cultural and religious factors. Many cultures and religions practice circumcision as a rite of passage or as part of tradition. For example, in Judaism and Islam, circumcision is a significant religious practice often performed shortly after birth or within the first few days of life. In some cultures, circumcision is seen as an important aspect of identity or social norms. Personal beliefs about body autonomy and ethics may also play a role in the decision-making process. Some parents feel it's important to let their child decide for themselves when they're older. Ultimately, this decision might be guided by your family's values and traditions. Be sure to have an open discussion with your partner and consider what feels right for you and your child. Alternatives to circumcision. If you're hesitant about circumcision, you might be wondering if there are alternatives. The answer is yes. Here are some things you can do to keep your child's penis healthy without circumcision. Proper hygiene. Regular washing and care can help keep the area clean and prevent infections. For uncircumcised boys, gently cleaning under the foreskin is recommended once it becomes retractable, usually around puberty, although some boys may be able to retract their foreskin as early as age 5. Preventing UTIs. While circumcision can lower UTI risk, maintaining proper hygiene and being mindful of bathroom habits can help prevent infections without surgery. It's important to note that some parents choose not to circumcise for reasons such as body autonomy or a desire to avoid the risks of surgery. These are valid reasons as well, and it's a personal choice every family should make with care. Making your decision. So how do you make this decision? Here are some helpful questions to consider. What are your family's cultural or religious beliefs? What are the potential health benefits, and do they outweigh the risks? How comfortable are you with the idea of your child undergoing surgery? Are you willing to wait and allow your child to make their own decision later in life? Or do you want to make it for them now? There is no right or wrong answer here. It's about finding what works for your family and making an informed decision. I hope this video has helped you think through the key factors in deciding whether or not to circumcise your baby. If you found this video helpful, please give it a thumbs up and subscribe for more parenting tips. And if you have any thoughts, experiences, or questions, feel free to share them in the comments below. This is a conversation many parents are having, and we'd love to hear from you. Thanks for watching.